Hi, and thanks for stopping by. Over the course of this short 13-minute PowerPoint presentation, you're going to learn how we've been able to eliminate the need for Tommy John surgery in more than 95% of the cases we've seen, all by utilizing the patented and proprietary ARP wave system. Without question, this will change the landscape of how we treat UCL injuries from here on out. So let's first talk about the foundation of the ARP wave system. Well, where everyone else treats the UCL pain and injury where it ended up, we find and treat the neurological origin of what caused it in the first place. You treat the neurological origin and you will eliminate the physiological symptom. So what is the ARP wave system? The ARP wave system is a patented, FDA-authorized soft tissue rehab system that can diagnose the origin of what's causing soft tissue pain and injury and eliminate the symptom 70 to 90% faster than traditional therapy. We've combined direct current with a high-frequency double exponential waveform that we invented that's harmonious to the body, allowing doctors to locate scar tissue and neurological disconnects without the impedance of fatty tissue or causing harm to the patient. Electric stim, laser, ultrasound, grafted, physical therapy, etc. cannot diagnose and eliminate the symptom permanently. The ARP wave can. The ARP wave system is able to treat the patient with active movement, breaking down scar tissue and allowing the muscles to lengthen, and more importantly, eliminating the compensation patterns that help cause the UCL issue in the first place. Traditional Tommy John therapy will take at least 8 to 10 weeks or more, and the patient will still be symptomatic. Our patented ARP wave therapy takes no more than 10 to 14 days, and the patient is pain-free and symptom-free. More importantly, our pictures are stronger and faster than they were before the injury. So who is Astra Group? Well, we were formed in 2012 and are a Miami-based sports medical and performance company utilizing the ARP wave system exclusively. Our website is www.astrallc.com. We own or co-own numerous ARP wave clinics throughout the U.S. and are the largest ARP wave neuro rehab clinic owner in North America. To date, Astra-owned clinics have eliminated an astounding 50-plus cases of players who were scheduled for Tommy John surgery, making us the leading source in the United States in eliminating the need for Tommy John surgery. Our success in eliminating the need for Tommy John surgery in 95% of the cases we have seen has been written about in the Miami Herald, Boston Globe, and 70 other periodicals too numerous to mention here. Please visit the website in the corner of the screen to read the newspaper articles and hear the many testimonials. Okay, so why is traditional UCL/Tommy John rehab ineffective? Well, look at it this way. We are an electrical being run by a nervous system, and just as your car needs shocks to absorb force, our body needs muscles to absorb force. The nervous system turns these shock absorbers on, if you will, to absorb and create force. If you fail to repair your car shocks, eventually you will ruin your car frame. If you fail to repair your shocks, eventually you will ruin your frame. It's that simple. UCL injuries are a neurological issue. They are not a physiological issue. Unfortunately, medicine today treats UCL injuries physiologically, and the patient is still symptomatic and the injury is still there, and the physiological problem is going to reappear again and again and again because the neurological origin has been left untreated and the shocks still do not work. Traditional therapy is ineffective in rehabbing UCL injuries. So what causes UCL pain and injury? Well, when a person attempts to perform any movement, a signal from the brain is sent for that supporting muscle or muscles to absorb the appropriate force. This is a neurological function. It's not a physiological function. However, the neurological signal to turn on the muscles is impeded due to scar tissue, creating a neurological disconnect. So this force has to go somewhere. So it's sent to a secondary location to absorb this load, notably an area of the body not meant to absorb force. In this case, the ulnar collateral ligament. This vicious cycle continues until repetition causes the UCL to break down, become severely inflamed, and ultimately tear if the origin is left untreated. Rest, ice, stim, massage, all are 100% useless. Until the origin of the UCL injury is treated, all the rehab, strength training, ice, heat, laser, ultrasound, rest, and therapy in the world is ineffective, period. So let's talk about the power of the ARP wave system, and more importantly, our patented three-step process to a 100% rehabbed UCL. The first thing we do is we have the pitcher perform a pitching movement to gauge the pain level, basing it on a scale of 1 to 10. We always want to benchmark when we start so we can see progress. Secondly, using the ARP wave device, we then scan the area of the injury to find the neurological origin. Our patented waveform penetrates healthy tissue, but it stops at scar tissue and inflammation. The patient lets us know if it's a 10 in intensity, which tells us that that is the origin of the UCL issue. It is never, ever the UCL itself. Ever. Once we find the first location, we scan it again to find the second origin. Then, we treat the player with our patented and proprietary protocols. Next, the patient's going to perform the proprietary UCL rehab protocols on the ARP wave device at 4 levels of intensity. At the end of the first session, UCL pain will be 25 to 33% less, and range of motion 25 to 33% greater as the neurological disconnect begins to disappear, and the muscles begin taking the force away from the UCL. By the end of the 4th session, the patient pain level is close to 0 or is 0, with a vast increase in range of motion. How is this possible? Well, the muscles are now holding an eccentric contraction, meaning they're lengthened. This is transferring the force away from the UCL and back to the muscles because they're now absorbing the force, and the signal from the brain is getting through fast enough, thus eliminating the pain and inflammation permanently. The second step of our patented process is what's called force absorption. In sessions 5 through 10, the patient is taken through different protocols to build up the muscle's ability to absorb force and create force, to essentially throw without pain. At the end of each session, the pitcher will throw 10 pitches at half speed until a pain level of 3. If the pain threshold is not hit after the warm-up, then the pitcher will throw at max velocity until a pain level of 3, then they stop, or until they're fatigued. Each session feeds off the last, and by session 10, the patient stops because of exhaustion, not because of pain. At this point, they're ready for game activity and to move onto the final 10 neuro strength training sessions. Typical recovery time is under 14 days in most cases. So let's see a before and after of how our therapy works. Prior to the Tommy John surgery elimination program, this would be the force distribution to the UCL. The brain would send a neurological signal for the muscles to create and absorb force. Unfortunately, they are impeded by scar tissue, creating a neurological disconnect. Well, this force has to go somewhere, so the force is then sent to the UCL region, causing continued pain and inflammation and slowly wearing the UCL down because it's not meant to absorb force. After our Tommy John surgery elimination program, this force is no longer going to the UCL, but has been transferred back to the supporting muscles, resulting in no pain and full range of motion. What does all this mean? It means rapid UCL healing and rapid rehab and back on the field better than you were before the injury. Now, let's go over 3 frequently asked questions we get all the time about the treatment. The first question we get is, how is the patient now out of pain? Well, as I mentioned earlier, the signal for the muscles to absorb and create force is no longer impeded. Therefore, the force of the throwing movement is transferred out of the UCL and back to the supporting muscles, the shock absorbers, if you will. No undue force on the UCL equals no pain and no tear. The second question we get a lot is, well, why couldn't I strengthen the muscles instead? Because size, speed, and strength does not prevent injury. If the muscles do not turn on fast enough, which is a neurological function, not a physical function, then no amount of PT or strength training in the world will prevent injury. Treating UCL pain and injury is strictly neurological. The signal from the brain needs to get through fast enough, and this is all due to the nervous system. Another question we get is, well, how long will this last? And that's a great question. Well, it's permanent. The neurological disconnect has been eliminated, and the compensation factors that help cause this issue in the first place are now broken by re-educating the correct movement neurologically at 500 times per second. That's 250 times faster than what you get in traditional therapy. The patient is now pain-free, symptom-free, and the chance of a UCL issue is all but eliminated permanently. The final step of our 3-step process is the neuro strength training phase. In the final 10 sessions, the patient is taken through our patented ARP wave neuro strength training segment. What we're going to do here is neurologically strengthen those muscles that have not been firing properly, probably for years. At the culmination of these final 20 sessions, the patient is now 100% asymptomatic, throwing without pain, and the muscles are neurologically firing like they were intended to do. Does our Tommy John surgery elimination program work? Well, to date, our head therapist at Peak Performance and Rehab, Paula Wallum, has eliminated 50 plus cases of potential Tommy John surgery and counting. But don't take our word for it. Go to peakperformanceandrehab.com and hear what coaches, parents, the media, and players had to say. Our success has been so rapid, we've now launched our patented Tommy John surgery elimination program inside our neuroperformance rehab and neuroperformance therapy clinics nationwide. Our clinic success has been written about in the Miami Herald, Boston Globe, CEO World Magazine, Milwaukee Sentinel, Pittsburgh Gazette, Fort Worth Star-Telegram, to name a few, in addition to a feature story on Fox 4 Dallas. Again, go to peakperformanceandrehab.com to see the news articles and the Fox story firsthand. So what is the next step? Call 929-ARP-WAVE to set up an appointment. If you want an in-home treatment, email info@peakperformanceandrehab.com for more information and to answer any further questions you may have. Thanks for stopping by and hearing about our revolutionary therapy. This is a game changer for baseball.